What if your body has been sending you a warning about diabetes every single day and you've just been missing it? Long before a blood test tells you anything, long before a doctor gives you a diagnosis, the first clues may already be showing up right on your feet. And what I'm going to share with you today could completely change how you look at your own health. I've been a doctor for more than 30 years. Just last month, a 67-year-old gentleman came in for a regular checkup. Before we even drew any blood, I asked him to tell me about his feet. He said, "Well, doc, my feet have felt a bit numb for a while now. I just thought it was getting older." He was showing 4 of the 9 signs I'm about to walk you through today. When his lab results came back, his fasting blood sugar was 168. He'd had diabetes for more than 2 years and didn't know it. The American Diabetes Association says that 1 out of every 5 Americans living with diabetes has no idea they even have it. That's more than 8 million people going about their day right now with a quiet condition that's slowly hurting their nerves, their kidneys, their eyes, and their feet. The good news, a simple blood test can catch it early, and for most seniors, Medicare covers it. But first, you have to know what the warning signs look like. Today, I'll walk you through 9 signs that may already be showing up on your feet. For each one, I'll explain what most folks think it is, what's really happening inside your body, and one easy daily habit that can help protect you. And sign number 9, almost no one ever talks about it. Once I show it to you, you won't be able to unsee it. All right, let's begin. Sign number 1, tingling or numbness in your feet. My patients will usually say something like, "My foot just falls asleep sometimes when I sit in an awkward position or when I've been sitting in one position too long." Sure, that happens to everybody now and then. But the question I always ask is this: is it happening over and over again, even when there's no reason for it? Because if the answer is yes, we need to have a real conversation. That kind of steady, repeated tingling or numbness in the feet, doctors call it peripheral neuropathy, is one of the very first signs that blood sugar has been running high for a while. All that extra sugar floating in your blood slowly starts damaging the outer coating of your nerves. It happens so slowly that most people don't even notice until it's been going on for years. I love this example and I use it with all my patients. Picture your nerves as electrical wires. Each wire has a plastic cover wrapped around it. That cover is what keeps the message traveling cleanly from your brain all the way down to your foot. When your blood sugar stays high for a long time, it acts almost like acid eating away at that plastic cover. The wire still works for a while, but the messages start getting mixed up. That mixed up signal is exactly what you feel as tingling. The American Diabetes Association reports that nearly half of all people with diabetes will develop peripheral neuropathy. It's the most common complication, and it almost always begins in the feet. That means millions of Americans right now are feeling this tingling and brushing it off as nothing. Please don't be one of them. Here's what I tell every patient over 60 to do. Walk for 20 to 30 minutes every day. Not a run, just a walk. Moving your body is one of the best things you can do to keep blood flowing to your feet and keep those nerves healthy, and start cutting back on added sugar today, not tomorrow, not next Monday, today. Sign number 2, a burning feeling on the bottom of your feet, especially at night. Many of my patients think this is just from standing all day or from the summer heat or from being tired. And sometimes, yes, that's all it is. But when a patient tells me their feet feel like they're on fire, especially when they lie down at night, I pay close attention. A burning feeling on the soles of your feet, particularly at bedtime, is a classic early warning of nerve damage from diabetes. The nerves in your feet have been hurt by high blood sugar, and now they're sending the wrong messages to your brain. Your brain thinks your feet are hot, even though nothing warm is touching them at all. The nerves are simply misfiring. Think of a fire alarm with a broken sensor. There's no fire in the building, but the alarm keeps going off because the sensor inside is damaged. Your nervous system is doing the exact same thing. That burning isn't coming from anything outside your body. It's coming from inside, from damaged nerve tissue that's crying out for help. A study published in the journal Diabetes Care showed that burning foot pain is often one of the earliest symptoms in people later diagnosed with type 2 diabetes, sometimes appearing 1 to 3 years before the diagnosis comes. For this sign, I recommend 2 simple habits. First, Drink plenty of water all day long. Staying hydrated helps your kidneys flush out extra sugar and supports healthy nerve tissue. Second, add more fiber to every meal you eat. Vegetables, beans, lentils, oats. Fiber slows down how fast sugar gets into your bloodstream, and that's exactly what those tired nerves need. Sign number 3, a wound on your foot that just won't heal. I need you to really listen carefully to this one because this is where things stop being uncomfortable and start becoming seriously dangerous. This is the sign that sends more patients to the emergency room than any other. They walk in and say, "I got a little blister from my shoe 3 weeks ago. It still hasn't closed up." They waited. They figured it would heal on its own. Most small cuts and scrapes do heal on their own unless your blood sugar is too high. When your blood sugar stays up, your body loses its ability to heal the way it should. The blood vessels all through your body, including the tiny ones feeding your feet, start to get narrower and stiffer. That means oxygen, white blood cells, and the building blocks that repair skin can't reach the wound quickly enough. So the wound just sits there open and slow to close. Imagine trying to water the plants in your garden, but there's a big kink in your hose. The water is there in the pipe. It just can't get to where it needs to go. That's exactly what high blood sugar does to the blood flow in your feet. The healing materials are in your blood, but they can't reach the spot that needs them. And an open wound that won't close becomes an infection just waiting to happen. The Centers for Disease Control tells us that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in this country. Around 154,000 diabetes-related amputations happen every year. Almost every single one started with a small wound that someone ignored. Tonight, after your bath or shower, sit down and really look at both of your feet. Look between every toe, check your heels. If you find any cut, blister, or broken skin, wash it gently with mild soap and water. Put on an antiseptic and cover it. If it hasn't started to heal within 48 hours, call your doctor. Not next week, not when I get around to it, within 48 hours. Sign number 4, dark color changes around your ankles. This one is sitting right out in the open. Most folks walk right past it every single day and never realize what they're seeing. It's visible. It's been there for months or even years. And almost nobody connects it to blood sugar. People notice their feet looking darker or more reddish and tell me it's probably just from the sun or my ankles have always been a bit darker. And sometimes, yes, that's true. But there is a specific kind of color change around the ankles that I pay close attention to when I'm checking someone for blood sugar problems. When high blood sugar damages your circulation, your lower legs and feet stop getting enough fresh oxygen-rich blood. The skin responds by changing color. You might see darkening, a deep red tone, or even a slightly bluish shade around your ankles. That color is your skin telling you that blood isn't getting to that area like it should. In some patients, the skin also becomes thinner and more delicate there. Another sign that the tissue isn't being properly fed. Here's how I explain it to my patients. Your blood is like a delivery truck carrying oxygen and nutrients to every part of your body. Your feet are at the end of the longest delivery route you've got, farther from your heart than anywhere else. When the roads get narrow because the blood vessels are damaged, deliveries stop showing up on time, the skin hungry for fresh oxygen starts to change color. It's a distress signal you can see with your own eyes if you know what to look for. A study in the Journal of the American Academy of Dermatology found that these kinds of skin changes can show up on average 18 months before someone is officially diagnosed with diabetes. The daily habit here is simple. Do 5 minutes of ankle circles, toe lifts, and calf stretches every morning. Even that small amount of movement helps blood get into your feet. And if exercise is hard for you, just raising your feet up a little while you sit can make a real difference. Sign number 5, deep cracks in your heels that no cream seems to fix. This one surprises my patients more than any other because it looks like such a small thing. In fact, most people have had cracked heels for years and never once thought to connect it to their blood sugar. My heels always crack in winter, Doc. It's just dry skin. I hear it all the time. And yes, that's very common. But when your heels are cracking badly in the middle of July or no cream seems to help no matter how much you put on, that's a completely different problem. Diabetes damages something called the autonomic nerves. These are the nerves that handle the automatic things in your body, the ones you never have to think about. One of their jobs is controlling the sweat and moisture in your skin. When these nerves get hurt, the sweat glands in your feet stop working right. Your feet lose their natural moisture from the inside. No amount of lotion can fix the real problem. Picture your skin like a brick wall that needs to stay sealed. When those autonomic nerves are damaged, the mortar holding the bricks together starts crumbling, cracks show up, and those cracks in the skin of your feet aren't just a cosmetic issue, they're open doorways for bacteria and infection. In a foot that already has poor blood flow, a simple infection can turn into something very serious very fast. I've had patients come in with heel cracks so deep they were actually bleeding. And they told me they'd been putting lotion on them for 2 years with no result. That's not a skin problem, that's a nerve problem. The American Podiatric Medical Association lists long-lasting, hard-to-treat cracked heels as a serious sign of autonomic nerve damage in seniors. And that damage is directly linked to blood sugar that's been too high for too long. Here's what to do. Every night before bed, moisturize your feet. A ura-based foot cream is what doctors recommend. Look for one with 10 to 25% ura on the label. These work much better than regular lotion for feet affected by diabetes. Rub it in well on the soles and heels, but never put moisturizer between your toes. That trapped wetness can cause fungal infections. And drink plenty of water throughout the day. Your skin needs moisture from the inside just as much as from the outside. Let me pause right here for a second. We've covered 5 signs so far. Have you noticed any of these on yourself or on someone you love? If the answer is yes, even just one sign, go down to the comments right now and type the word yes. I read every single comment. And if this is helping you, please tap the like button. It takes 1 second and it helps YouTube show this to more seniors who need to see it. All right, let's keep going. Sign number 6, swelling in your feet and ankles that just won't go down. This one is more serious than people realize because it's not only about your feet. It's also about what might be happening to your kidneys at the same time. Almost every patient I've seen with this says, I sit at a desk all day or I'm on my feet all day at work. A little swelling from sitting or standing is normal. I want to be clear about that. But when your feet and ankles are swollen most of the time and you're seeing deep sock marks every evening, that's a different story. High blood sugar harms the kidneys. Your kidneys are the organs that manage all the fluid in your body. When they're not working right after years of too much glucose, fluid starts collecting in the lowest part of your body, your feet and ankles. That kind of swelling is called edema, and it's a sign that your body's filter system is under real stress. Think of your kidneys like the water filter plant for a whole city. Every drop of blood passes through them to get cleaned. When high blood sugar damages those filters, the whole system backs up. The extra fluid has nowhere to go but down. Gravity takes care of the rest. The fluid pulls up in your ankles. When you press your finger into the swelling, the dent stays there for a few seconds. That's called pitting edema, and it's not something to brush aside. The National Kidney Foundation reports that kidney disease from diabetes affects about 1 in every 3 adults with diabetes. And swelling in the lower legs is often the first visible sign that the kidneys are struggling. When you're resting, prop your feet up higher than your heart. Even a couple of inches on a pillow helps. This lets the trapped fluid drain back toward the middle of your body. Also, cut back on salt. Too much salt makes your body hold on to water, which makes swelling much worse. Read the labels. A lot of canned and packaged foods are packed with sodium. And if the swelling is new, or it's not going away, or it's getting worse, please mention it to your doctor at your next visit. Don't let it turn into a bigger problem. Sign number 8, feet that stay cold no matter the weather. This one tells me how far the damage has gone. When I see this in a patient, I know we're past the early stage. They'll tell me, Doc, I've always had cold feet. My wife has stolen the electric blanket every winter for 30 years, and I laugh along with them. But then I ask, are your feet cold in July? Are they still cold under 3 blankets? Because that's when I get concerned. Cold feet that don't warm up no matter what's going on around you. Cold in summer, cold under a pile of blankets, cold even when the rest of your body feels fine, are a strong sign that blood flow to your lower legs is badly reduced. Your blood vessels have gotten so narrow or stiff that warm blood just isn't reaching your feet in the amounts it should. Picture your blood vessels like a heating system with pipes running to every room in the house. When those pipes get narrow because of damage from high blood sugar, the heat doesn't reach the far end of the house. That room stays cold no matter how hard the furnace works. That cold has nothing to do with the weather outside. It has everything to do with the pipes inside. The American Heart Association reports that peripheral artery disease, where blood vessels narrow, affects more than 8 million Americans, and diabetes is the single biggest risk factor. Cold feet are one of the earliest and most common signs. The best thing you can do is walk briskly for 30 minutes every single day. Not a slow walk, a real walk with your arms swinging. This forces blood to move down into your feet and legs, strengthens the walls of your blood vessels, and over time can actually reverse some of the early damage. Start with 10 minutes if 30 feels like too much. What matters is that you begin today. Sign number 9, hair loss on your feet and lower legs. This is the one almost nobody talks about. I've never once seen it in a patient pamphlet. Most people walk right past it, and honestly, so do many doctors. But once you know about it, you won't ever miss it again. I rarely have to bring this up because patients almost never notice it on their own. But during a foot exam, when I look at the lower legs and the tops of the feet, sometimes there's a clear lack of hair in those spots. The patient will look down and say, I never noticed that. And that's exactly the problem. It's a quiet sign, easy to overlook, but it matters. Hair follicles need a steady supply of blood and oxygen to do their job. When blood flow gets seriously reduced by years of high blood sugar, the follicles in your feet and lower legs slowly stop getting what they need. Over time, they simply stop growing hair at all. That hair loss is a visible sign of blood vessel damage that's been building up sometimes for many years. Picture hair follicles as little plants in a garden. When the water pipe feeding them narrows or gets clogged, the plants don't die right away. They just slowly stop growing. The missing hair is your body's way of telling you something about your blood vessels, a message you can see anytime you look down at your legs. Research in the journal Diabetes and Obesity has shown that hair loss on the lower legs is strongly linked to poor blood flow in diabetic patients. It's a reliable sign and one that doctors are specifically trained to check for, though most patients have no idea it exists. Right after this video, take a look at your lower legs and the tops of your feet. If the hair is much thinner than on the rest of your leg or it's missing completely, book a blood sugar test this week, not this month, this week. It's a simple blood test. Medicare covers it for most seniors, and it costs very little out of pocket. It could change the whole direction of your health. We've gone through a lot today. 9 signs, 9 chances to catch something before it catches you. I want to be honest with you about something. One of the hardest parts of my job is sitting across from a patient who's had every single one of these signs for 2 years and is only now finding out what they mean. Not because they didn't care about their health. They cared a lot. They just didn't have the information. Now you have it. And I'm going to ask you to do just one thing with it, one small thing. Tonight, before you climb into bed, sit down and look at your feet. Take 30 seconds. Look at your skin. Check between your toes. Feel for any numbness. Look for any wound that shouldn't be there. Just 30 seconds. That's all I'm asking. And if you see or feel anything from this list, please call your doctor tomorrow. Not next week, tomorrow. Because the earlier you catch these things, the more you can do about them. In most cases, with simple changes to your diet, a daily walk, and a real conversation with your doctor. You worked hard for the life you have, for your independence, for your health, for being able to do the things you love. Don't let something as manageable as blood sugar take any of that away from you just because nobody told you what signs to look for. Now, if this helped you today, please share this video on Facebook right now. Tag someone you care about, a family member, a friend, a neighbor. You might be giving them something they didn't even know they needed. I post a new video every week on this channel. The kind of things I talk about with my patients every day, things most folks never hear outside of a doctor's office. Subscribe and bring someone you love along with you. Stay aware, stay on top of it, and take good care of those feet. I'll see you in the next.